He's been doing a great job of doing that already, so kudos to y'all. Hello, everybody. Welcome. For those who don't know me, my name is Claire Fitzgerald. So I'm chairing the session today. I'm a research fellow here at the Government Outcomes Lab. And this is our Emergency Responses and Government Outcomes group. So thank you all for spending a bit of time with us today. I've said this at each of our sessions so far, but just sort of a heads up that Ergo is supposed to be a platform for those in government, providing organizations, academia, as well as other sectors to share their experiences ongoing of emergency and disaster response and recovery. And this is including, but not just limited to COVID-19. The idea here is that we're reflecting on some of the wider implications of emergency context in outcomes-based approaches. So basically, we've gotten some feedback from folks, and it appears like we're doing this okay. So thank you for those of you who have written in comments and suggestions and even just nice things. I hope you'll see some of those suggestions fed into the conversation today, as well as some future ones. Which I think, speaking of, I thought it would be instructive to kind of just talk through some of the cadence of upcoming Ergo meetings so we can set some expectations for y'all. You've noticed that we've really sort of gone hard and heavy in terms of the first stage of things, and we've been doing weekly sessions. Moving forward, we're going to taper that down slightly. We'll still keep both formats that we've been trialing. So what we're moving to is one structured conversation, like we'll have today, and then one open session per month. And these will fall quite regularly on the first and the second Wednesdays of each month. So you'll note at the bottom of your agenda that the next session will be on the 6th of May. And this is a structured conversation on the effects of COVID-19 in lower and middle income countries. And in particular, we're kind of looking at the implications for outcomes contracts, something that many of you have requested when you registered for Ergo. And I also wanted to flag that the timing of this session on the 6th is slightly earlier in the day, so it'll be 1 p.m. UK. And this is in order to accommodate our friends in other parts of the world. The week following, on the 15th of May, we'll have another one of our open sessions, and the details of that we'll sort of share closer to the date. So as always, I hope that these are valuable to you and that you'll stay involved by joining conversations and helping shape the group. So maybe as a speaker or a future commentator on one of these calls. And so I will flag related to that we are looking to put together a session towards the summertime around the implications of COVID-19 on new research and evaluation activities or existing ones. So if you're keen to speak on that, shoot us an email, which you can find at the bottom of your agenda. I'll also flag at the end of today's session, we've carved out a bit of time to get your feedback via a sort of online questionnaire thing. So that's also a place where you can flag what you'd be interested in doing. So as for outputs, another heads up, I'll circulate notes from our first structured session, the COVID-19 and outcomes contracts, as well as our first open session, where we heard about the operational realities of outcomes projects in Cameroon and Belgium. So shout out to Hortense and Patrick for jumping in and sharing what their projects are doing. Those notes I'll circulate at the end of the month. And I also just want to say, like I always do, that should we compose any policy briefs or memoranda which sort of stem from these Ergo conversations, we will share those with participants. And to enable that kind of output, we are recording today's session like we usually do. So with that, I'll sort of move on to the framing of the conversation that we'll have today, which is really around exploring this tension between that was my notes, hold on. This tension between sort of needing flexibility while maintaining accountability across contracting and service delivery during and recovering from emergencies. And the idea here is that the sort of emergency context requires stakeholders to work quite rapidly at pace to adapt existing service delivery and then respond to new and pressing challenges. And so the speakers that we'll hear from today have been asked to sort of outline maybe some guiding principles of good contracting governance, transparency, and accountability in these emergency times, and to identify sort of potentially the implications of COVID-19 in response and recovery ongoing for governments. So as we've articulated in the agenda, there's sort of maybe three overarching questions we're asking here. One is around how governments can ensure appropriate accountability whilst enabling flexibility to rapidly respond to crises. One is around some like common sense principles of contracting governance, transparency, and accountability. And then another question around sort of how access to and quality of data can really enable decision making in sort of all phases of an emergency, both during response and recovery. And I think sort of just by way of background, the way that this came up as a topic that we might want to talk about was in colleagues' emails back and forth here at the School of Government, as well as in some parallel conversations amongst other peer learning groups, including the group that gets convened on procurement. And what really became evident, I think, in these conversations was that there exists a sort of wealth of experience to draw on from folks who know the ins and outs of open data initiatives, sort of what went right and wrong during other stimulus efforts, probably most notably the 2009 financial crisis, sort of what government experience in flexing contracts looks like, and sort of know-how on how to work with contractors who are going through some pretty tough spots. And then also the sort of expertise in public scrutiny bodies, whose role is to think critically about the role of governance and scrutiny to ensure good decision-making within government. So all of this experience exists out there, and it can get leveraged to help us answer a lot of the questions that have arisen around what we should be doing for public service contracts, particularly outcomes contracts, as governments sort of the world over have begun to rethink what their strategies look like in light of COVID-19. So these questions have been things around the kinds of data service providers should be collecting, what and how should governments and service providers be negotiating contracts and their relationships, sort of what does good governance really look like, and what's the role of data in it? And then also how government might elect to scrutinize or audit spending after the fact, and how might provider organizations really prepare for that. So before we sort of jump full steam ahead into the agenda, just a couple of housekeeping notes from me. We've got good numbers on the line, and sort of the format is slightly structured. So just a couple things, which is please keep yourself on mute unless you're speaking. I'll follow the timings on the agenda as closely as I can, and as timing allows, we'll invite comments and questions. When we go to comments or questions, if you could use the raise hand feature in Zoom. I think you find it if you go to participants, and then you'll see a little animated hand. So you can click that or click it off if you want to lower your hand. Alternatively, if you're more of a chat function person, if you type your question in the chat box, I'll do my best to get to it and sort of feed it into the conversation as we move along. I will do my best to get to everybody, but undoubtedly I'm going to miss folks, so I apologize for that. So without further ado, I think we'll sort of move into the meat of the conversation today. And first, we are exploring the role of data in emergency response and recovery. And so we'll hear from two presenters, and then that will be followed up by some questions from my colleague, Rory. So first on the list is Hudson Hollister, who is the founder and CEO of HData. He is a former US congressional staffer, Securities and Exchange Commission attorney, and a major advocate for open data and government. Hudson helped craft the landmark US government data reforms, including Digital Accountability and Transparency Act of 2014, as well as the Financial Transparency Act. So today, Hudson is going to be talking us through the rationale behind these sort of transparency legislation, and also sharing with us some of the lessons from the Recovery Act, which for those of you who might not be familiar with that, that's the US stimulus package that was in response to the 2009 financial crisis. So Hudson, I'll pass it over to you, and we're excited to learn from you.
Thank you. Thank you, Claire, and thanks to the Government Outcomes Lab. It's an honor to be invited, and I am excited to see so much attention on transparency and accountability, even in the middle of a pandemic. I think that's inspiring, and I think building these things together is crucial. In thinking about how to talk through this history, that's the point that came to mind first, the idea that there is a need for transparency and accountability right from the beginning, because in a crisis like this one, the perception of the public sector and the perception of those organizations that are seeking to help is part and parcel with their actual services. And so being able to for the public to be able to understand exactly how their elected representatives are addressing a crisis, and to buy into that and to support that is just as important in a crisis on the scale of this one as the services themselves. I'm excited to have the chance to talk through some of the history from the US of efforts to bring electronic transparency and accountability to the responses to crises. And I'm planning to talk through the history of the Recovery Act, which was the US government's response to the economic downturn of 2008, 2009. And then second, the Data Act, which was the US government's attempt to take some of those lessons and make them permanent and do that kind of accountability for all spending forever in the future. And then finally, I can give you an update on the transparency and accountability provisions that apply to the spending that has been appropriated by the US Congress for pandemic response, which actually is going to be at least 2.5 times the size of the response to the economic downturn of 08, 09. I'm excited to see all of you and to connect with all of you. And I'm especially grateful to Ruri McDonald for connecting us. Ruri is a former colleague of mine. We worked together at the Data Foundation. So Ruri, thank you. I guess I'll start with the history. And then Claire, I would also like to ask for you or for anyone to wave as I talk if you have a burning question, so that this is not just a monologue. When the US government and other governments around the world faced the largest economic downturn in many decades in 2008, 2009, there were 2 different main legislative responses by the US Congress. One of them was directly addressing the dislocation in financial services, popularly known as the bailout package that happened in the fall of 2008. And then in February 2009, Congress passed the American Recovery and Reinvestment Act, popularly known as the Recovery Act. That was the bill which, that was the law which mandated the spending of about $700 billion on grants and loans and contracts. A great deal of it flowed through the state governments, to address unemployment and to address the economic downturn. From the beginning, Congress decided to attach special transparency requirements to these awards. The unprecedented part of the Recovery Act was in Section 1512. Congress required every recipient of grants and loans and contracts that came out of this funding, every recipient, that's all the way down the different levels of grant and sub-grant, contract and subcontract, every recipient had to prepare and submit quarterly accountability reports on their use of the funding. That was in addition to all of the compliance requirements they had separately. Just like in other countries around the world, US grantees and contractors have reporting obligations that are attached to their receipt of the funds. Grantees have to do an annual report. Grantees, if they receive more than a certain amount of money, have to do an audit. Those things were still happening. But in addition to that, the Recovery Act imposed a special quarterly reporting requirement on recipients. Originally, recipients were expected to submit this quarterly report to their funding agency. Recipients receiving funds from the Department of Education were to submit a special quarterly report to the Department of Education. Recipients receiving funds from the Department of Labor to Labor, and so on and so forth. The reports had to contain specific information, the amount of funds received, the amount of funds that were spent, a list of the programs on which they were spent, and most controversially, an estimation of the number of jobs created or saved by the award. Nobody gave much thought in Congress to how that was to be tracked. This gave grantees and contractors a great deal of stress. They wanted to comply with this reporting requirements in good faith, and yet no one had given them instructions on how to take one of their existing headcount and decide whether it really had been retained as a result of getting this grant or contract award. Another problem at the outset was that the agencies dispersing the Recovery Act funds did not have much guidance on how to administer the reporting requirements, and very rapidly they began applying different and inconsistent reporting requirements, and this meant that the entities receiving stimulus grants and contracts, especially if they were receiving stimulus grants and contracts from different agencies, notably state governments receiving grants and contracts from everywhere, they would have inconsistent reporting requirements layered on top of each other, and very rapidly that became unsustainable. I should add, even though we've got federalism in the U.S. government, the structure of federal grants makes our government in practice a bit more unitary than our Constitution suggests. The federal government puts out over $600 billion in grants every year to the state and local governments, particularly to the state governments. Federal grants make up a very significant portion of the funding that flows to the state governments, in addition to their own tax revenues. The conditions that are attached to the receipt of federal grants are often very prescriptive, and this means that we look a lot more like a unitary system than you'd think from reading the Constitution. Anyway, the solution to all this, and what I think made the Recovery Act program a success, is that the Recovery Act also set up a special temporary entity, the Recovery Accountability and Transparency Board, known as the Recovery Board, which was charged with aggregating and analyzing all the information that flowed in about the Special Recovery Act grants and contracts. Thanks for the heads up. I see I've got 5 minutes to go faster. The Recovery Board was a committee of inspectors general. Each U.S. federal agency has an office of the inspector general. There was a committee set up that was comprised of a select group of them, and the committee had its own staff and its own purview, its own contracting authority. The Recovery Board saw this challenge and they rose to it. The Recovery Board took over the reporting requirement from the agencies, set up a special centralized portal at federalreporting.gov, still available on the Wayback Machine, federalreporting.gov, to facilitate reporting by the entities receiving the stimulus grants and contracts. They set up a government-wide standardized data schema for that information. They normalized the instructions on how to track those jobs created and saved. And as a result of the common data format, software developers were able to put together tools that allowed the recipients to report automatically. By the time we'd gotten through a couple of cycles, these products were available, and this dramatically reduced the reporting burden for the recipients. By the time we got to the end of the stimulus program in 2012, there was remarkable bipartisan support for the work of the Recovery Board. There was a great deal of acrimony. There was at that time a great deal of acrimony about spending, even macroeconomic stimulus in the U.S. government. And that, by the way, that's not true now. Everybody agrees that we should be spending trillions of extra dollars. There's not a political battle over that anymore. At the time there was, but Republicans and Democrats almost uniformly supported the work of the Recovery Board. And there was a pretty clear consensus that the incidence of fraud and waste had been much lower in stimulus spending than in the regular budget, even though the stimulus spending had to go out faster. There are reports from the Government Accountability Office that indicate that there was less fraud here. As a result of the centralized reporting, as a result of the common instructions across government, and especially as a result of the data standards, the specific fields and formats that were uniform across all the programs. The Data Act was an attempt to build on that. I wrote the first draft of the Data Act when I was a congressional staffer, and I founded a trade association called the Data Coalition to lobby for the passage of the Data Act. The Data Act, which was enacted in 2014, sets up a common schema for all US federal spending information, allowing interoperability across the different agencies. One thing the Data Act did not do is the Data Act did not set up a single regime for the reporting of accountability information by the recipients of all grants and contracts. That is still in process. Actually, last December, President Trump signed the Grants Reporting the Grants Reporting Efficiency and Agreements Transparency Act, the GREAT Act does seek to create a uniform reporting regime for all of the recipients of grants that come from the US federal government. Finally, I want to talk about the present. On March 27th, Congress passed and President Trump signed the CARES Act, the third out of three, but counting, there will be more, the third out of three pandemic response laws. The CARES Act includes a regime that is closely modeled on, even copied and pasted from the Recovery Act. The CARES Act sets up a special committee just like the Recovery Act did. It's called the Pandemic Response Accountability Committee, or PRAC. The CARES Act also requires the recipients of pandemic response grants and contracts to report quarterly. The CARES Act contemplates that this reporting will flow to the PRAC. So just like we had recipient reporting and the Recovery Board under the Recovery Act 11 years ago, we now have recipient reporting and the PRAC under the CARES Act. It's now looking as though there's a negotiation going on today on Capitol Hill on a fourth law in response to the pandemic that will refill the fund that is used by the Small Business Administration to provide small business loans. And that reporting structure, that accountability structure, is going to apply to this fourth one as well. The leadership of the PRAC is currently being seated. We are expecting the executive director, the head of this temporary agency, to be announced on Friday. And given the experience of the Recovery Act and the Data Act, I think that the expertise exists to do lightweight reporting that is possible to comply with, possible to extract the data out of recipients' existing systems in order to provide the transparency and the accountability and the confidence, even as we're doing this on an emergency basis. That's the story. I think there are principles that come out of that story, but I want to stop there and see if there are questions or if it's time to go to Oscar. Thank you.
Thank you, Hudson. I think we'll go ahead and head to Hollister, and then I think Rory will be following with some clarifying questions. But what I think was really helpful to understand from that, perhaps coming out of the 2009 response to things, is that having a sort of centralized reporting structure with some clear data standards was integral to actually accelerating the pace with which institutions were capable of demonstrating that indeed that they were handling these stimulus dollars well. I think helpful to keep in mind as governments the world over are likely to move to getting money out the door quite quickly, and having a kind of apparatus like that in place being a potentially sort of helpful element to that.
Yes.
Oscar, I'm going to pass it over to you, but I'll introduce you first. So next we're going to hear from Oscar Hernandez, who is the Latin American Program Manager with the Open Contracting Partnership. So Oscar's work focuses on using evidence-based approaches to increase the effectiveness of public policies. And prior to joining the Open Contracting Partnership, he was an Innovation Fellow with the Harvard Kennedy School of Government, or Harvard Kennedy School Government Performance Lab, where he led multiple projects with US and Latin American cities implementing outcomes-based procurement strategies and evidence-based policies for human services and core government operations. So today, Oscar is going to talk to us about the value and importance of having real-time data on contract implementation, which is really helpful, I think, for existing contracts, for the governments and service providers party to them to identify trends and perhaps troubleshoot problems in real time. So perhaps slightly different than Hudson's advice on when we're doing new spend, here's a structure for enabling us to understand how that money is being spent. I think from Oscar, we're going to hear quite a lot about the importance of having some live data embedded into your contracts, maybe both pre-existing, as well as ones that you set up. So over to you, Oscar.
Thank you. I hope you can see my screen now. I'm projecting a few slides that I have here. So thanks so much, Claire, for inviting me to this panel. This is really interesting. And also thank you for this introduction. I think many of the things that I'm going to be talking about are really related to the experience that I had both working directly with outcomes contracts and in my current role, mostly working in open contracting, right? So basically what I want to talk about is the importance of openness in public procurement in the fight against COVID-19. And I guess, as Hudson was mentioned before, I think public procurement has really become a central activity during the pandemic. And you know, governments around the world are buying all sorts of goods and services to address this crisis. But at the same time, the pandemic has quickly expanded the number, the scope and scale of tasks that governments are expected to perform, especially to serve most vulnerable communities. And in this context, transparency and accountability in public contracting has become really important in ensuring trust from key stakeholders, as well as guaranteeing efficient processes and quality of the goods and services that are being procured. So I think like the most important thing that I want to say about that is that across the entire procurement cycle, this is true, right? And just like having real-time open data about contract implementation will enable governments and service providers to collaborate better, so that they can actually identify trends of what's going on with service provision and troubleshoot their problems, as Claire kind of like advanced in what I was trying to say. So I just wanted to start very briefly explaining about the Open Contracting Partnership, which is the place where I work now. And I think basically what we've been doing for these past 5 years is working with governments and their stakeholders to implement data-driven reform projects that improve the effectiveness and fairness of government contracting. And what we have seen over these last 5 years is that open contracting can really make a big difference in improving service delivery when it's done right. And what I mean by doing it right is just both having timely, high quality open data, and also allowing businesses, civil society, and other stakeholders to have a voice and the government to listen. So that can really create the necessary feedback loops to enable savings and improve services for citizens. So one of the core products that we have at OCP, as we call it, is the Open Contracting Data Standard. And this is something that we basically use, as I was saying, to advance data-driven reforms and collaboration between different stakeholders. And basically the standard enables us to disclose the disclosure of data, enables the disclosure of data and documents at all stages of the contracting process, from planning to implementation. And it basically tells you, or it really provides guidance on what to publish and how to publish it. And that makes it easier, obviously, to compare and analyze data. So basically the way to understand the standard is if you were to have a table, it would always tell you exactly what you need to publish at each stage of the procurement process. And then governments or publishers can really decide exactly what data is most valuable to them to publish. So the whole idea here is really describing the contracting process, not a single stage, not just the tender or the contract, but the entire process from planning to delivery to payment, right? And we define each process with a unique identifier, which is what you see here, the OCID. And that really allows you to capture what happens from inception to end. And really just like having data for each stage of the procurement process enables different types of use cases. So for example, timely publication of budget and project plans in the procurement stage enables better strategic planning and better user research. And publishing contract implementation data, which includes data on payments, milestones, and amendments, enables better contract management and systems reengineering. So even if you're not an OCS publisher, this structure can really help you identify what data you have available in your system and what fields could be disclosed to enable collaboration and better results. So basically, open contracting really pairs very well with outcomes-based contracts. And the idea is just like that open contracting engages various stakeholders, both from inside and outside government, to identify and fix problems across the entire procurement cycle. And as you know, too often new contracts are issued and past contracts are renewed without assessing what worked well in the past and defining current priorities. So basically, what open contracting can help you do is really, engage service providers and end users and relevant community groups to collect feedback and understand their needs before drafting any solicitations or any procurement documents. And also, it can help you communicate priorities and align incentives. So just collecting and publishing contract information can really advance understanding of past contract performance, helping the internal city staff choose a set of metrics that is relevant for any set of contracts. And then finally, I think just like in terms of implementation, all the work that you're doing, really it's about trying to outline goals and establish metrics in the contract itself to have a foundation to establish a solutions-oriented relationship with contractors. And open contracting data is it's a great support tool to hold high-frequency data-oriented meetings with vendors, so that you can actually celebrate successes, but also detect and rapidly respond to problems and make consistent improvements in performance. So the idea here is that by sharing this data with the people you're collaborating with, it can really unleash positive feedbacks by growing awareness to contract effectiveness. And I think like this is perhaps the most relevant feature from open contracting to navigate the ongoing crisis. So, just like by using this data to actively manage contract, you can assess results in real times and then find solutions with providers. But for that to happen, you also need to collect and share performance data in different dimensions, even those indicators that probably are not associated with payments. And this is perhaps also opens the window to enable to collect and share data about final beneficiaries. So I'm going to move faster here because I know I'm running out of time. And just wanted to sum up with some big lessons that we have learned in the way open contracting is helping governments navigate the COVID-19 crisis. So, as I said, governments need to move more quickly than legal frameworks typically allowed, and several governments are passing emergency decrees and measures to enable more agile procurement. So the better examples are the ones that also include, centralization or other methods to aggregate demand, so that you can coordinate procurement to ensure that supply gets to where it's most needed, and also includes transparency requirements. So I think the best example that we have of this right now is that countries such as the Ukraine, where emergency procurement rules really allow you to have direct purchases, but with very little red tape. But at the same time, the data must be recorded in the system and published the next day. But also in terms of coordination, I think the worst examples are situations where, as we have seen, we see hospitals, agencies, local and national governments bidding against each other for a limited supply. And just coordinating and centralizing demand can really help you manage critical supply chains. And I think something that we have seen work very well was an example led by Canada in engaging very rapidly with the private sector by publishing an open call to all potential suppliers for key products to combat COVID-19. And we have seen many governments across Latin America using this approach also to have more robust supply chains. So in terms of data, I think, as I was saying, having good open data helps with coordination. It allows faster market research and also allows due diligence in terms of supply chain and management. And those countries that are already using the open contracting data standard are doing much better in this regard. So we can see both Paraguay and Ukraine, just like being able very quickly to identify all procurements that are associated with attending the emergency. And we have also developed some guidance in terms of what data fields you should be looking at in case you're interested, and I'll put that in the chat box in a little bit. And then finally, in terms of data use and monitoring, I think, good data allows us to compare prices and compare performance of different suppliers, but it's also relevant for the challenges that lie ahead in terms of fiscal and economic recovery, both in terms of just like knowing what vendors you need to engage, and then improving the efficiency and value for money of the contracting. So just to sum up here, I think good data can also allow you to identify powerful patterns in contracting, and you can really use very simple data analysis techniques to look into that. So just like having good data really allows you to look at individual units, including individual service providers, and compare their performance, or geographic units to understand if there are communities that are being underserved, and also just like finding across different participant characteristics of your services what's going well and what's not. And the idea of building innovative partnerships is actually finding ways in which other people can provide that data for you, and that you can track performance of your contracts. So that's pretty much what I wanted to say today. And if you're really interested in getting started with either the open contracting data standard or finding ways in which open data can help you better manage your contracts, please feel free to reach out. This is my email here, and I will also put in the chat box our website. Thanks.
Amazing. Thanks for that, Oscar. I think an interesting sort of overlap between the need for standard items and perhaps the open contracting partnership being a place where folks might consider pulling some of those standard data items across the whole sort of phase of the procurement cycle, as you were. Rory, I'm going to invite you to maybe ask sort of 2 or 3 clarifying or discussion questions that might sort of connect some of the conversation that we've had so far with some of the concerns that we have through both outcomes-oriented contracts, as well as thinking and applying these lessons into some of those contracts directly. So I'll pass it over to you, Rory, for just a couple questions.
Cool, thank you. So my name is Rory McDonald. I have met many of you. I am a research associate at the Go Lab, and I lead some of our work around the procurement of government outcomes, or POGO. So we have a POGO club that meets monthly, and you're all welcome to join if procurement and public contracting is your thing. Hudson mentioned that I was at the Data Coalition. As an intern, he was my boss, so it's really nice to be able to put him on the hot seat here. But I promise to be hopefully helpful. So many of us work with outcomes-based contracting, outcomes contracts, including, for example, impact bonds. And there are about 170 of these impact bonds around the world. Each impact bond has at least 3 partners or parties. And these parties could be government, they're often a provider of social services, they're often an investor. And I feel like this group is actually quite good at collecting and using data, because they have to figure out the outcomes and they sort of have to track these outcomes. And so within that group and within these 170 groups around the world, I think there's a predisposition towards data and a competence that may not exist in other projects. But why should these groups start to share their data is something that comes to mind. I mean, this can't all just be about accountability. Just because you say so doesn't mean that, you know, I should take resources away from my work on the outcomes and the sharing of the outcomes data internally. What are the sort of, you know, what are the reasons that you see that organizations should publish and share data? And then if they decide that they actually, you know, we should do this, how do they go about deciding to do it in a way that's helpful more broadly? That's my question for Hudson, if that wasn't clear. I've got another one for Oscar.
Oh, sure. I guess I would first point out that organizations, that government organizations, there's already a hailstorm of reporting requirements and obligations. There are already for federal grantees in some sectors of federal grant making. There is a reported figure of 43% overhead. I think that's in university research. 43% overhead, which means that 43% of the value of the grant is being spent on the cost of filling out forms about that grant. So the data collection is already happening. The challenge is to make the data collection meaningful and to reduce all of that additional effort that's not being invested on whatever it is the grant is supposed to pay for. And I emphatically believe, and I hope this gets to your question, and I hope to get a follow-up question if it doesn't. I emphatically believe that if the government got smarter at specifying the data fields and formats, I thought that the way that Claire summarized it a few minutes ago was better than my rant, that a centralized reporting structure and key data standards, if governments could just do that, then the solutions necessary to automatically extract the information from the existing systems of the recipients could be built. It would be commercially viable for providers to build competing solutions to automatically pull the information and report it to government. The trouble is that specifying those data standards is outside anyone's purview. It's not specific to any area of grant making. It's not specific to any policy area. Open contracting is beginning to solve that problem in procurement. There isn't an open contracting for grants. There are these efforts in the U.S. federal government, like the GREAT Act, which I mentioned. But my overall answer, Rory, is that there are information flows already, and if we want more meaningful information, we should focus on those and try to build the meaningful into that. And data standards are the way to make it automated and meaningful. Is that helpful, or maybe I didn't strike at the heart?
I think that was very helpful. And I know that Grants 360, which is a UK-based sort of initiative, has got a data standard around grants. There are many in this call will be familiar with the work done on international aid transparency, the IATI standard. And actually, we are pulling together some of these different standards and are currently scoping. I didn't plan to tell people this, but I will. We're currently scoping an international network for data and impact around government outcomes, or Indigo, to try and sort of use these different standards from different sectors to get, in a meaningful way for outcomes-based contracts and other sort of cross-sector collaborations. But anyway, I'm going to be asking questions, not speaking. I'm going to get in trouble with Claire. Who's my?
If you have any resources on that, would you put them into the chat?
Yes.
Thank you.
I did want to turn to ask Oscar a question.
Sorry, Rory, do you mind if I just share my 2 cents on what the question you just asked, and Hudson, because I think it's a really relevant question. I think so. And just building on what he said, just like my experience in the U.S. So I work in the U.S. with multiple state and local governments in just like creating outcomes-based contracts. And this is kind of like a really hard sell for many governments and many stakeholders, just because just like what we call the transaction costs, or like everything that surrounds like social impact bonds and like all of these like pay for performance devices and all of that, it's really high, right? I think like one of the key selling points that we had for this kind of thing was that like it was really just like thinking of outcomes thoroughly and just like doing that work of like actually getting to that data would lead to systems re-engineering, right? And I think like systems re-engineering in terms of all the things that Hudson was saying, just like, like being able to actually understand what are the actually effective reporting requirements that you need from service provider in terms of like, just like not like avoiding attrition in terms of the things that they need to do. And we saw that a lot in governments like Seattle working in homelessness, just like standardizing those reports. I think like that all like what I'm trying to say here is that if like you can try to convince people by saying, like just like going to open data is going to take you even one step further in that direction in terms of like making work easier for everyone. Just like being able to access data in real time, being able to access from like data from other programs that can inform how you can better just like define your services. It's kind of like really going to change the culture in how you implement these contracts. And I think like that's why it's such a good question. Like how, why you should just like move not only in the direction of just like start collecting data on outcomes and sharing that with your service providers, but sharing more openly that information.
Yeah, thanks. And it occurs to me, having worked with small organizations and consulting with government, that these, like, it's not free, right? I mean, open data and freedom of information work is not free. It takes an investment for organizations to actually, change their processes and produce these data. And it doesn't make sense unless there's a use case for it, or that it's somehow making things more efficient. Okay, I did want to ask you, Oscar, more about OCP. So the Open Contracting Partnership, I actually worked there as well, so forgive me. But before Oscar was there. So you're a World Bank spinoff, and one of the reasons I think that you exist, and you can correct me if I'm wrong, is that the World Bank was sort of interested in, when it's lending money to countries, being able to sort of understand, well, how these countries then spending this money through their own contracting systems or for the World Bank contracting system. So I get that, you know, that was sort of like the initial thing, and that was a number of years ago. But you now have been working in multiple countries around the world. Do you see a different perception around sort of the use of open data in procurement and other fields in different countries? A lot of us have experience in the UK, and I know the UK government in theory publishes the open contract and data standards through Contract Finder. But I wanted to sort of get a sense of how different places, different regions around the world sort of perceive this work. But also, we're in an emergency. Do you have examples? I think you mentioned a couple there. Do you have examples of where you know, sharing these data is helpful in this kind of emergency situation?
Thanks, Barry. That's a great question. And I think, I mean, so this was obviously before my time, but I do think, you know, like, in a way, the entire transparency culture that inspired OCP at its beginning had a lot to do with kind of like this like external monitoring organism trying to understand exactly how governments were spending their money. And, you know, obviously adopting the open contracting data standard will make you, you know, it's not only about like sharing open data, but also being comparable to other countries. But I think like, you know, even though some countries are still interested in that, just like complying to international standards and all of that, I think we have seen, and what has changed a lot, at least, you know, from all the time that I spent with OCP, I think like what governments really are interested in is just like being able to share this information with their citizens, but not only like even with users within governments, right? So we often think, and I think like that's something that anyone who has worked in government has also experienced, you know, like government works in silos, right? And even just being able to access data from the own government that you need to kind of like run an effective program, or like being able to do market research to kind of like understand what are the needs for this specific procurement, it's really hard just because that data is not in an open format, even if you have all the data sharing agreements in place. And it also allows you, just like having standardized data, just like actually allows you to track performance over time, which is something that doesn't happen when you have like different regulations changing all the time, and then like your data field changing all of the time. Just like this is just like a way to track what's being changed over time and being able to compare yourself in terms of whether you're improving or not. So I think like all of those features about standardized open data kind of like really can help you basically improve service delivery through data. And I think like that's what kind of like the interest that we're saying. And just like in terms of examples, in that website, there's a ton of them, but I think like what we're seeing right now is that, you know, cities like Buenos Aires are being able to very quickly identify all of the procurements that are associated with the emergency. The Ukraine is also kind of like publishing that data in a way that it's being able to track things in real time. And we have seen like outcomes of that in both directions, both in terms of social accountability and better performance. So in Paraguay, just like having that data available has allowed them, like led to a quick, like finding out really quick about a scandal of someone who was buying overpriced items, even like in light of the emergency, just like a clear case of corruption leading to the resignation of the head of an agency, can't remember which one. And also just like the people using standardized data to reach out to vendors that weren't like kind of like in their procurement database, and like just like vendors were like also providing services that they need in light of the emergencies, such as ventilators, stuff like that. It's like being able to reach out to them also through standardized data. So I think like those are kind of like the two things that we're seeing and that we're reporting on.
That's been really helpful. And actually, I think this is an interesting pivot into sort of the next chunk of our conversation today, which is it's important that the data comes out, it's clean, it's open, it's accessible, but it has to get translated and then used subsequently in decision making, right? And there's a whole host of different routines and individuals that have to get pulled together to make those kinds of decisions, particularly around perhaps offering flexibilities or recasting service delivery in light of a pandemic. So the next sort of portion of the agenda will take the same structure that we just had, which is sort of two presentations followed up by clarifying questions, and time allowing, we'll open it up to hear from everybody on the call as well. And so really thinking through what these perhaps new routines or flexibilities and decisions being made in government. First, we're going to hear from Cody Kinsley, who is the Deputy Secretary for Behavioral Health and Intellectual and Developmental Disabilities at the North Carolina Department for Health and Human Services. So Cody leads statewide public policy and operations that promote whole person health by developing prevention methods, interventions, and systems of care for individuals living with mental illness, intellectual or developmental disabilities, traumatic brain injury, and substance use disorders. And so to that end, he oversees the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services, which develops policy and funds community-based services and supports. And he also oversees the Division of State-Operated Healthcare Facilities, which operates the 14 different facilities that comprise the sort of state of North Carolina's publicly funded health system. And so today's Cody's talking to us about the sort of North Carolina Department of Health and Human Services approach to flexing and adapting a lot of their contracts with service providers, chief among them perhaps some of the managed care organizations, while they also ensure service quality. And so Cody, I'll pass it over to you. And it's nice to see your face. Cody and I are both from North Carolina, so we know each other from home. But anyway, over to you, Cody.
Hi, Claire. Thank you so much. It's a pleasure to be with you all today. And actually, I'm going to amend my bio a little bit because I love being in this group and talking with all of you. I feel like I'm surrounded by friends. Before this role, I was the Assistant Secretary for Management at the U.S. Treasury in the current administration and in the previous administration. And in that role, obviously oversaw all aspects of finance, acquisition, operations broadly, so functioning the COO and the CFO of the department. And as part of that, kind of on the tail end of some of Hudson's comments and others, saw the kind of sunsetting of TARP and all that was happening and kind of the residual aspects of oversight that were part of that. And of course, the department's kind of standing $6 billion annual procurement spend. And now, in this role, in the midst of this crisis, I've, in addition to the behavioral health work that I have done in leading the system here in North Carolina, I've also just taken on broad leadership for the state's medical surge operational response aspect of what we're doing here. And so I agree with everything that's been said so far with regard to kind of, the need for, I guess my basic proposition is that generally a lot of these systems and governments don't work well under normal circumstances. And so, and kind of the spirit of, I think, what everybody shares on this Zoom is the effort to try to improve those, with whether it's open data, clearer processes, more consistency across them, to improve them in general circumstances. And then in the midst of a crisis, right, there's these kind of really quick gut decisions that are being made about what processes are being thrown out the window versus what's being kept and what's the marginal value of those across the board, right? And so I want to hit on a few examples. So I think first and foremost, where at least North Carolina is, and I would imagine many other places across the world, is obviously really focused on personal protective equipment and the critical supplies that are necessary to respond to the crisis. And in our context, we're just about to hit $300 million worth of purchases for PPE, of which we have secured about 4.5% of those have actually been shipped in. I checked with my vendor vetting team this morning. We've had, thousands of offers, right? I think you've all probably heard tell of stories of just, everybody is trying to hold a shingle up and set up a shop. We've vetted over 600 different offers so far. We have 300 more to go. And while a lot of these are legitimate businesses, many of them don't have stock or anything in supply. So there's just a lot of noise in the system. So the already, the normal government contracting process of going out for bid is kind of gone. We're all kind of quickly reacting to the vendors that are being offered to us. And that's actually really important, I think, issue in the accountability schema, because we don't, we're not going out to buy things that we need. We're generally want to, the strategy is find and buy, so we're just reacting to the things that are coming out of us. That's where you've seen national coalitions set up like Project N95 and others that have tried to provide third-party syndication of these sorts of things to try to inject more transparency and do that work. I think the other thing, and this is speaking in the US context, there hasn't been a lot of federal leadership on this issue. And so I think that it's hard for us to tell the difference where there's price gouging and where the market is just driving up prices because 50 some states are competing with each other to try to get the best price. And frankly, globally, that's happening generally. So the kind of basic tool of strategic sourcing is not available to us in this sense because we don't have good clarity about how much need we have over a long period of time. And we don't have a bulk buy strategy because we're not all working together. So we're all buying little bits and pieces with random vendors that are doing some sort of markup. So there's a lot of cost that is being added on in premium pricing. And I put all that out on the table to say how much of that is okay because of the market and how much of that is bad use of resources, right? And to what degree will accountability fall in that kind of spectrum of that work? And so, and I think, and unfortunately, to lean on my behavioral health role, there's a fair amount of PTSD among the emergency management folks who are now making these calls about buying because of past accountability exercises that fell down on them. So how do we, and so that's been something that's really been hard to kind of work through, how to have that lean oversight. I think, again, Hudson, pulling from something you said with regard to the Recovery Act, how do we kind of build that in that way? So that I think is and how do we have enough transparency? And I think our strategy has been to try to just release as much of that information publicly as we could along the way. So that way we're kind of sunshining it as much as possible so that kind of collectively we're all in this together in a way. And while that won't necessarily guarantee that we're getting the best value, but it does, I think, limit some risk. The next thing I'll just move to is, I think, more in line with what Claire hoped I would talk about, which is thinking about, now that I've wasted all my time on not what she wants, but
you're doing great.
What are the, we talked about the money that's going to procurement and other purchasing, and then, but obviously there's money that's passing to the hospitals and all these big, massive recovery bills, and it's just fascinating to me to watch. I remember when the $700 billion bill was just like a bridge too far, and now it's just, we're on the trillions upon trillions and money in a thing. But now moving to the kind of medical oversight, right? So we operate in North Carolina these public managed care organizations. We've got 3.2 million people that are in the public system, and it's a semi-federalized system of delivery. The United States has created an effort, is strive to create the most confusing medical delivery system possible, and it's heavily reliant upon cascading levels of checks and minimal balance. And so what we're struggling right now in the middle of a health pandemic is that we've essentially shifted the method of care for every single person in the country, or in the state, I should speak for myself, to telehealth and other outpatient things that they had never gotten before, or not used to. And so there's a lot of confusion around HIPAA compliance. There's a lot of confusion around technology rules. There isn't really good standard. There's attempts at standards for EHRs, but they're not widely adopted, especially in the behavioral health space. And it's a workforce that there's a huge spectrum between like paraprofessionals, such as peer supports and CNAs, all the way up to psychiatrists. And in behavioral health, there's a huge gamut between. And there's a lot of variation in their ability to kind of, to be blunt, think for themselves about how to like do the best thing with good judgment. And in their defense, they're being used to being heavily regulated, right? So we spend about $14 billion a year on providing healthcare services in the public, in this basic Medicaid public sector safety net system. and to try to help them quickly pivot to entirely different domains of providing that care while still ensuring that some sort of service is happening. Because if these folks go into behavioral health crisis, they'll flood the EDs, the hospitals will become overrun, and they won't be able to manage that. So that's been really difficult for us to kind of strike that balance of where do we waive requirements. And it's gotten, unfortunately, as granular as staffing ratios and other things. And because what I have learned very quickly, which is without surprise, is that America, the land of independence, where everybody says the government doesn't impact them and they want it to be small, in this moment, they're all 100% confident that it's the government's responsibility. And so trying to figure out how to build that daisy chain of responsibilities and that new routine essentially from the ground up is really challenging. So that's kind of a scope out. I'm happy to kind of keep diving in with questions, but I think I've exhausted my time. So thank you.
Cody, that was really helpful. I think really trying to understand, and maybe a theme between sort of the presentations that we heard earlier and what you've just said, which is actually the level of procedural detail that is required to actually getting some of these systems up and running. And it becomes sort of an urgent need, especially when there's an emergency, whether that be the details on a data standard versus the details on a procedures for what actual service delivery requirements need to look like. What I'll do now is sort of pass it over to Jackie, and I'm sure she'll sort of develop some of these themes that we've been talking about a bit further. So Jackie McKinley is the chief executive of the Centre for Public Scrutiny here in the UK, and it's the leading national organization promoting and supporting excellence in governance and scrutiny. And so she oversees the centre's work on a wide range of sectors, which is around local government, national government, health and social care, education, and the sort of private sector and housing side of things. And so prior to joining the Centre, Jackie was the Director of Strategy and Customer Services at Stafford County Council, and has worked in health and sport and the civil service. And so today, Jackie is going to be talking around sort of a lot of the supports that her organization has begun to provide around COVID-19 to governments, really thinking about how those entities might reestablish routines and strategies around transparency and accountability in decision-making in this kind of very volatile context. So Jackie, I'll pass it over to you.
Thanks, Claire. Hi, everyone. Really pleased to have the opportunity to contribute today and hopefully build on some of the great contributions so far. So, as Claire said, we are a national charity, so independent, UK-wide view of what's happening at the moment. So what I thought was it would be helpful to kind of describe what we've seen in relation to governance during this kind of crisis response period, what's kind of acceptable and not acceptable, and how we think that the governance principles should be kind of established, and also what opportunities this tragic situation we're in might give us from a governance perspective. And as I think Hudson and Oscar said before, it's quite nice to talk to governance and other kind of like-minded people in this situation. So it does feel like we're amongst friends here. So, in answering the question that you set as Claire, which is about what are the common sense principles of governance that we apply in a normal, steady state? From my organisation's point of view, they're really similar to what we've talked about already around clear responsibility, clear accountability, operating in a transparent way, being open to scrutiny and keen to involve people, and being evidence-led. And I think our approach to governance has always been from a very pragmatic point of view, seeing it as an enabler, not as a barrier. And I think, if we take an approach to governance which is about compliance without having a view on getting the culture right, behaviours, relationships, we're really not going to be operating as effectively as possible. And I say that because I think that some of the activities and some of the things that we will review later on will show us that we've had some real flaws in the system, a real approach to a regulatory approach to governance, a real approach to clients. I love the phrase before around a kind of hailstorm of reporting. So I think we're starting to see that the system we've created didn't work in the first place, and now we're kind of exposing some of that. But I think from what we've seen, our view is, a time of crisis, you need those principles of accountability, transparency, and good governance even before. So from a really pragmatic point of view, I think what we've seen, and I'll try and talk from the context of democratic and non-democratic and the kind of different organisations, probably as much from a commissioner as well as a provider. But, you know, what we've seen in the initial stages is a need to cut back on traditional approaches to governance. And some of that's been necessary and been mirrored in other crises before. So naturally, organisations need more freedom to make big operational decisions, as we've heard, around procurement. Approaches to finances need to shift to accommodate pressing local need, draw down additional funds, and respond to kind of changing policy decisions. And all of that needs to be kind of happen without the burden that some traditional approaches to governance require. We've also, I think, in this situation, maybe different to before, have needed to see a change to governance because of some, you know, the real practical things around staff in those governance positions have been self-isolating, have been ill. You know, we saw half of the British cabinet at one point isolating, as well as some of our health leads, Prime Minister in hospital. So, you know, there's been a real difference in how we've been able to operate some of our reporting and governance arrangements. And then we've obviously had the impact on travel and social contact. And I think what that showed us was actually most of our governance was based on very, very traditional ways of working, a real meeting approach to life, a real, if you're not in the room, you can't make decisions. And I think a lot of that's been exposed. So what we saw in that initial phase was, as I said, the need to kind of remove some of the burdens and reframe approaches. So we saw meetings being postponed, usual performance management suspended, a lot more of an informal approach. We talked a lot about use of emergency and delegated powers and emergency regulations that's happened. And I think all of that is right and appropriate. But what we are seeing is, you know, particularly the big decisions around economic and social you know, life and limb type things, they still have to be subject to oversight and scrutiny. And we know that they will be subject to reviews and audits. And we're starting to get this sense now, and, you know, particularly from a political perspective, is, you know, what will the review look like? What will the kind of decisions? And I think what's different this time, maybe compared to some of the other emergency situations that we've dealt with, is, you know, they tend to be quite short term. And I think since the Second World War, most of the emergencies that we've dealt with in this kind of category have been short term and relatively localized. And when we look at the financial crash, you know, whilst there was an element of kind of shock to that, it wasn't necessarily of the nature of the health and the economic crisis that we're dealing with now. So I think there is a danger in thinking that governance can kind of be postponed or put on hold, or, you know, emergency fast-tracked for a sustained period of time. I think also the usual approach that we take to emergencies, where everything is centralised, we get this strong expert leadership, tend to be right for the short-term operational responses, but not for the high-level sustained period that we're likely to be in now, which, you know, who knows how long it's going to be, but we could be talking up to 12 months here. So what we've been doing is talking to organisations about how they need to look at their governance plans for 2020, 2021. And that's everything from contract management to audit to performance reporting, and look at what those shifts and changes are that need to be put in place now. And really that means going back to those basic principles. So when we talk about, you know, who is ultimately accountable for public spend and the achievement of those outcomes, and even if they are stuck at home and not able to get, you know, into a boardroom or into the places they're normally making decisions, they still have that vital role to play. And what we've seen in some organisations throughout the UK is this shift away from this shift away from kind of non-executive decision making towards executive decision making, which again is right in a kind of emergency situation. But, you know, if you've got democracy in place, democracy is still relevant, and probably more so during this period. So we need to find ways to do that. We need to still be involving others. And I think from a public commissioning point of view, now is not the time to ignore those who are delivering public services. You know, inevitably they will have more insight, more kind of relevant information. And also we need to be making sure that we're still securing buy-in to decisions. And I think the British government has kind of made attempts to do that through its daily briefings, its kind of public campaigns and others. But, you know, as we look at it from the different lenses of organisations that are making decisions, it's a really difficult ask. And we've seen some great uses of digital and social media during this period. And I think we're learning a huge amount about how do you kind of knit together and engage the kind of democracy, the professionals, the communities, the citizen activists that are kind of doing brilliant jobs at the moment. So how do we kind of tie that together from a governance point of view? So our view is that now is a great opportunity to kind of try and find ways that where accountability and oversight can look more distributed and more dynamic, which is actually a really challenging thing to do, because our instinct in this period is tend to kind of centralize and drive things upwards rather than down. So I think we're seeing some interesting dynamics there. And I think really, particularly as we get towards the recovery phase, if we can start to view governance from the perspective where it has much more of a citizen voice, much more community-led, much more kind of ethical governance at the heart, it would be a good opportunity, I think, for some good to come out of this. So I think what we are starting to see is these new ways of working obviously are happening. So we're seeing much more, well, as we're demonstrating today, much more coming together remotely, much more coming together virtually in local areas. And how that kind of data and insight has been driven up to inform decisions, I think will become more relevant as we get established into this new normal. For those in governance positions, we're really working hard to make sure, and they are working hard to make sure they're not left behind. So ensuring that governance and insight is there, but is proportionate. So what we're saying in the UK is, now is the time for scrutiny. It's not the time to not scrutinise, but let's find a way to do that where, we're not necessarily, and we've had accusations of kind of scrutiny distracting people away from decision making and, distracting them from the day job. And we're kind of trying to get across that it is the day job, being transparent and visible of what you're doing. We've talked a lot about reporting already, so I won't go into that, but we're seeing these patterns where it's kind of, we've gone from all the systems that we've had in place to it either being excessive to non-existent, I think is, so from a reporting point of view, those high profile pressure points, we talked already about kind of hospital deaths, PPE care, absolutely kind of drowning in requests for information. And we've seen the pattern here, as I'm sure other people have in different parts of the world, where we've gone from, really high profile scrutiny of hospital deaths into what's happening in care homes. So I think we'll start to see those patterns shift where, for example, we've probably seen, greater reporting of domestic violence deaths here in the UK during the lockdown period, but not as much around child safeguarding. And I think it will be interesting to see where public attention goes during this period, and what will we look back in hindsight and think actually we should have been shining a light on that during this time. I think there's still a demand where we have to try and find ways to make meetings publicly accessible, and in the UK we've now got powers where we can operate virtual meetings. We're finding much more public engagement in that, and actually they are meetings where that kind of public broadcasting and challenge of decision making is starting to happen in a way that we've been arguing for years, and all of a sudden it's now happening. So I think they will be that will be really important. And also the kind of regular briefings and transparency of information. I think from a provider point of view, even though that attention might not be on your organisation right now, I think there's a real need to kind of keep that level of transparency that we've talked about, and go back and kind of try and publish as much as we can to make sure that that kind of public record of activity and decision making is there for when we come out of this. So I think, as a kind of conclusion, there's a kind of compliance view that we can take of governance during this period, which is, how will we be audited? What questions will we be asked? What kind of failures and risks do we need to kind of be able to apply here? But we can't just see it from that perspective. I think if we do that, we'll start going down, the wrong kind of view, although I think organisations do need to be aware of that. I think from my perspective, that there is a real opportunity for some really valuable learning that will come out of this. And I think being able to ask questions, which is, how has this approach to governance during this period impacted on outcomes? You know, has it freed us up? Has it enabled us? Has it meant decision making is more efficient, more effective? I think will be one. The second is, you know, did the approach that we take to decision makers bring us closer to citizens and communities? And how did we use that insight that we gathered in order to inform those decisions, as you said earlier, Claire, or where we ask them for reports and information that never hit the decision making points and never hit the formal decisions? Did it kind of get locked in performance management? And also, you know, what were the developments that we were forced to put in place that we'd now like to keep, please? You know, so if we go back to not being able to have virtual decision making in democratic environments, I think that, you know, it will be terribly flawed. So I think, you know, we've seen the traditional approaches to governance curtailed by necessity. And I think we've got an opportunity to replace them, one in a way that equips us best for recovery. And, you know, we are in this unprecedented times in our kind of corporate governance memories, but also, you know, allows us to reset governance to enable better outcomes to happen. And I think for me, if we're able to do that, then, you know, a really kind of terrible situation will hopefully put us in a better position moving forward.
Thanks for that, Jackie. I think, I suppose to me, some interesting parallels. I know, Cody, you mentioned sort of a question around, like, in something like this, what can you really be held accountable for aside from assuring a reasonable process and publishing data as it becomes available to you? And I think also hearing from you, Jackie, really thinking through, this isn't so much about compliance. This is about really trying to shift and change these systems so that they can be perhaps more adaptive and live once we sort of move into post-COVID or some sort of recovery phase. For the sake of time, I am going to relinquish sort of perhaps my personal questions that I have for Cody and Jackie, and see, in fact, if anybody on the call wants to jump in with a question. If that's the case, you can raise a hand or shoot something into the chat. So I'll pause and see if any hands go up. All right, no hands. So then I get to use my question. All right. So I think, Cody, my question to you is actually sort of around perhaps linking the data usage and data sharing conversation with what you all are doing in DHHS, which is kind of maybe a twofold question. What was the information that you really would have liked to have had that you didn't have and sort of had to make a decision with imperfect information in hand? And then two, maybe if you could talk about the role of data in sort of the prioritization around issues. Where have you relinquished or sort of flexed particular things versus insisted on particular facets of service delivery, and how was data used in some of those decisions?
Yeah, so I will tackle this from both the PPE and the service delivery perspective. So from the critical supplies perspective, you know, no system ever existed in managing kind of N95 masks, starting from state all the way to outpatient care provider, right? And if we're trying to answer the simple question of how much do I need to buy, then I need to know how much we have, how much requests we're getting, what that's going to look like, and then also some sense of what the case rate is going to be potentially in the model. So kind of what I've been calling those data points is the Bermuda Triangle of trying to find exactly what I should be aiming for and how much money I'm going to spend, because at some point from the accountability perspective, someone's going to say, why in the world did you buy 21.9 million N95s? What was your logic in getting there? And right now, you know, I'd say we have like 60% cloudy data on those need demand, on what hospitals and other providers currently have, what they're asking us for, and, you know, what the case rate may drive the need to be. And I think the other piece that's important to layer over all those is that right now, yeah, all of that is, I would say, well, 80% of it is all self-reported data. And so it's all covered up with everybody's own kind of gamification risk of like, I'm going to hedge high and hoping that I get something from the state. So I think that's a big piece on the PPE side. On the patient service delivery side, I have real life and limb questions around, you know, how many people, you know, we're even in certain types of services that don't easily lend themselves to a telehealth modality, who are likely really vulnerable and at risk for some sort of crisis, who we could be doing some sort of proactive outreach to. And sans having a some sort of actual HIE or other integrated health information setting, we don't know how to actively go after folks. And the best data we have is claims data, which has a 90-day lag on it. So building those kind of coordinated systems to understand where our people are and how do we serve them, we're really flying blind and relying heavily on providers who, like, you know, and our instructions are as good as, well, reach out to the people you did services with for the past 2 weeks before the pandemic, and let's hope that that's a good coverage point. And so that's just, I think that's how blind we are to what the actual needs are. And that, I think, limits our ability to be proactive.
Sure. I think really helpful, I think, to understand how difficult it is to know what data you might need in a future situation so that you could plan it. I mean, that's an impossible question, but I suppose perhaps the rationale, you know, behind some of the open contracting. Jackie, I kind of want to ping it over to you. You talked a lot about perhaps changes to and maybe even improvements to governance around some of the issues that are coming up. And I know as a team, we've had lots of questions coming in around sort of what good governance looks like. And I think part of the reason we're getting a lot of these questions is because we've not yet landed on a sort of level of detail satisfactory for some of the folks in our audience. And so I'm curious if you could talk maybe a bit more about kind of the governance mechanisms. How often are people having phone calls and meetings, and how ad hoc is it, or how formalized is it, and who's on those calls? So maybe just talk a bit about the kind of patterns of good governance in a real kind of operational sense. I think might be helpful detail for folks.
Yeah, that's a really good question, Claire, and I think it's like the $1 million question that you've posed. If we all could answer what does good governance look like in these circumstances, you know, I think it's hard because it's very it's often very, very specific to the circumstances. And I think, you know, as Cody has just really kind of articulate, you know, in a situation where we are flying so blind in certain circumstances, and it is life and limb type decisions, you know that there will be gold command meetings or whatever the equivalent is happening daily in some circumstances, you know, starting off with an 8 o'clock in the morning meeting, ending off with 10 o'clock at night meeting, which is kind of trying to control and manage a situation and direct resources accordingly. So you've probably got that at one end of the situation. In the others, we've dropped into the informal, we've got a trusted relationship, carry on. And I know, you know, I'm a trustee of an advocacy project in London, and we're kind of in there. We're here if you need us, but we don't want to get in the way of you managing operations on a day-to-day basis. So, you know, but I think that is the right answer in the kind of crisis emergency phase. I think as we go forward, what we'd be expecting to see from a good governance point of view is that accountability is being held by those who are accountable. And I think what happens in a crisis situation, it can drop down to executives, managers, operational people. That's right. We need to make sure that that is being held by the board, by politicians, by whoever needs to see it. Transparency, I think you'll need to be able to prove all the way through, even on the decisions that you're making, you know, in an emergency situation. And as we settle into this as a new normal, then citizens and the public will need to see that they're being taken into account, and that their views and I think that's where we're starting to see in the UK that, you know, some of the challenges around national level initiatives. So we had an NHS volunteering scheme launched, lots of PR razzmatazz, when actually it was probably 3 weeks behind what had happened at a community level, and lots of community activism and local proactivity. And I think what we're starting to see is how do we marry those up, and how do we kind of make sure that the national initiatives are connecting locally, and some of the questions that a slightly calmer situation allow that transparency of decision making to happen. And so, you know, I think really realistic, proportionate governance is what will be the right answer. However, you know, the longer we get into this, the more we need to establish a kind of normal cadence to governance, whether that's your monthly meetings going to fortnightly, whatever it might be for the situation. And I think that's where, you know, what will be the test as we look back on this for organisations.
Yeah, I think I'm going to try to pull strands together because we're towards the end of our time as a group. But I think what's come out to me that's, I think, quite helpful is that, you know, we have this quite maybe ad hoc and responsive element to a lot of the conversations that are going on, be they within government entities or amongst private provider organizations. And there's lots of critical decisions that have to get made, and the importance perhaps of good quality data feeding into those decisions can't sort of be underscored enough. But what the right cadence or what the right makeup of those decisions looks like is a highly contextualized kind of question. And it's difficult to be able to be prescriptive about necessarily who should be at the table, how often that table should meet, and what exactly need to be the agenda items. But I think what's been helpful about the conversation that we've had all together is that a lot of the work that's going on isn't necessarily to service compliance considerations, although those are incredibly important. There is a lot around the duty of communication to citizens, and that a lot of the work to be transparent can be helpful in navigating those relationships direct to citizens. I think also sort of really understanding the intersection of a political machine as well, and where accountability sit on that side of things. Sadly, we're out of time today, but it's been a really fascinating conversation. And thank you so much for joining it, everybody on the call, to our presenters especially. I really appreciate your time. I have shared a link in the chat, which is just a short survey about sort of what today's session was like for you, what could be improved, what could fall onto agendas for new sessions. So I invite you to click on that link and complete that survey. And I also just think it's been really nice to think about accountability perhaps a bit earlier in the phase of things than in other emergencies that I know I've sort of been around coffee tables and meeting room tables discussing. So hopefully we can continue on a lot of these conversation threads in subsequent sessions of Ergo, and perhaps in all of our organizations respectively. So I appreciate everyone's time. I will flag that there is a session next week with the POGO group that Rory hosts, which is actually specifically around corruption and outcomes, which I imagine will pick up on some of these things. So definitely check that out. It's next week on the 28th. And again, as a group for Ergo, we meet next on the 6th of May to talk about the effects of COVID in lower and middle income countries. And so I hope to see you there. I hope this was a great session for you all. It was great for me, and I appreciate your time, and I hope you have a great rest of your afternoon. Thanks so much.
Thanks, everyone.
Thank you.